Surgical respiratory emergencies in the newborn. Causes: upper airway and intrathoracic causes. Upper airway causes: MICROGNATHIA, MACROGLOSSIA, choanal atresia, tumors, cysts, or enlarged thyroid remnants. Laryngeal or tracheal causes. MICROGNATHIA, well seen in Pierre-Robin syndrome. Pierre-Robin syndrome, a congenital defect. Micrognathia and glossotosis often associated with cleft palate. Small lower jaw plus strong sucking action lead to sucking back of the tongue to occlude the larynx. It is a life-threatening problem. Most of the diseased infants, mild cases, should be kept and fed in the prone position. A nasogastric or gastrostomy tube may be necessary for feeding and preventing laryngeal occlusion. Tracheostomy is done on failure of conservative treatment. The tongue may be sutured anteriorly to the lower jaw, but this frequently breaks down. The lower jaw develops normally by time. The infants eventually learn how to keep the tongue from occluding the airway. MICROGNATHIA. MACROGLOSSIA. Muscular hypertrophy, hypothyroidism, and lymphangioma. MACROGLOSSIA. Choanal atresia may be unilateral and asymptomatic, or may be membranous in 10% and bony in 90% of cases. Severe respiratory distress if bilateral. Diagnosis confirmed by inability to pass a tube through the nose. Choanal atresia, photograph and X-ray. Congenital pharyngeal or laryngeal tumors, cysts, and stenosis. Lingual thyroid and teratoma are tumors affecting the pharyngeal airway. Pharyngeal or laryngeal hemangioma, lymphangioma, neurofibroma, and fibrosarcoma. Thyroglossal cysts, pharyngeal inclusion cysts, and laryngeal cysts. Lingual thyroid, lingual teratoma, pharyngeal and laryngeal hemangioma, tumors, cysts, or enlarged thyroid remnants in the pharynx and in the neck. Photographs. Laryngeal or tracheal causes. Laryngeal or tracheal stenosis, webs, cysts, tumors, or vocal cord paralysis. Laryngeal stenosis, web, tumor, and paralysis. Tracheal stenosis, web, tumor, and cyst. The rules of treatment of congenital pharyngeal or laryngeal tumors, cysts, and stenosis. Excision and repair of the laryngeal fibrous webs. Maintenance of a patent airway is the first choice before treating the obstructing lesion. Fixation of an endotracheal tube or tracheostomy. Administration of thyroid hormone to diminish the size of the lingual thyroid. Aspiration or malsupilization of the cysts until excision. Excision of laryngeal webs and repeated dilatations for thicker webs. Intrathoracic causes. Atelectasis, pneumothorax, or pneumomediastinum. Pleural effusion or chylothorax. Pulmonary cyst sequestration and tumors. Tracheomalacia or bronchomalacia. Congenital lobar emphysema. Diaphragmatic hernia or eventration. Esophageal atresia or tracheoesophageal fistula. Vascular rings, mediastinal tumors or cysts. Lung atelectasis, pneumothorax, pneumomediastinum, pleural effusion, chylothorax, pulmonary cyst sequestration or tumor. Trachea and bronchi, tracheomalacia or bronchomalacia. Congenital lobar emphysema. Diaphragmatic hernia, posterior, anterior, and lateral views, X-ray. Diaphragmatic eventration, esophageal atresia, tracheoesophageal fistula, chest and abdomen plain X-ray showing esophageal atresia with gas in the stomach and intestine, denoting the presence of a tracheoesophageal fistula. Vascular rings. Abnormal formation of the aorta and or its surrounding blood vessels. The trachea and esophagus are completely encircled and sometimes compressed by a ring formed by these vessels. This can lead to respiratory and or swallowing difficulties. The vascular ring diagrams. Vascular rings in X-ray. Good luck and best wishes.